Bine v-am regăsit, doamnelor, domnilor, aici la Sănătatea fără frontiere, așa cum v-am obișnuit, săptămânal în studioul Observatorul Prahovean, medici de top din Turcia. Evident, prin intermediul StreamYard vom stabili conexiunile de rigoare. Astăzi, alături de noi, se află doamna doctor Sena Ulu. Domnia sa este specialist în nefrologie. Hello, doctor. Nice to see you. Nice to talk to you. How are you?
Hi, nice to see you. Thank you. I'm fine. And you?
I would like to start our interview, doctor, by asking you what are the symptoms when we talk about kidney diseases?
Yeah. Actually, kidney disease is a silent and insidious disease. Progresses quietly and voiceless. Mostly, it doesn't show any signs or symptoms until the end stage. It causes some complaints such as noisy, vomiting, edema, weakness, shortness of breath, pallor. But these findings appears at the end. We can see it at the end stage, and these findings show us that the patient reached the end stage and need for dialysis. So I repeat again, the kidney disease is a silent disease and progresses quietly. So we have to be careful more than the other diseases.
How do we know, doctor, that we have a kidney disease if it's a silent disease?
Yeah, unfortunately, we cannot know if we don't take any tests or we don't take any follow-up from the doctor, regular tests. We can find it only with regular tests, unfortunately. I'm sorry about it.
Okay, I understand. And I would also like to know what are the factors when we are talking about kidney diseases?
Okay, diabetes, hypertension, obesity, frequently urinary tract infections, kidney stones, genetic kidney disorders, for example, familial Mediterranean fever, polycystic diseases, smoking, alcohol consumption, drug abuse, excessive drug use, insufficient water intake, painkillers, irregular lifestyle. These are the risk factors for kidney disease. Also, people who are overweight or obese, they have about 5 times greater risk of kidney disease. What can we do about it? In order to prevent kidney disease, we recommend our patients dial sufficient water intake, regular exercise, and healthy lifestyle. Regular sleep, avoidance of unnecessary drug use, especially antibiotics or painkillers, and regular follow-up by a nephrologist if they have diabetes or hypertension or they have any other risk factors.
You spoke, doctor, about diabetes. Is this disease dangerous for the kidneys?
Yeah, diabetes is so dangerous for kidneys. Diabetes is a serious health problem with the highest number of patients worldwide. It causes kidney disease in 1 in 3 patients. Unfortunately, like the other kidney diseases, diabetic patients' kidney failure cannot be diagnosed at early stages because, as I said before, it progresses slowly and silently. But if a diabetic patient have regular follow-up by a nephrologist, there is a chance to detect the disease at the early stage with early findings, such as what do we look to the patient in the tests. We look for microalbuminuria, proteinuria. These are the symptoms of diabetic kidney disease. And at that time, if we detect it at the early stages, we can save the patient. For example, we can give some drugs and we can give some treatments to patients, and we can save the patients at that time before the disease and progress. We recommend nutrition, exercise, regular follow-up, in order to be protected from the disease and, of course, its complications.
Can you give me some information about hypertension and its importance?
Yeah, it's another important subject for us. Our kidneys play an important role in regulating blood pressure because our kidneys regulate the water and salt balance, and kidneys secrete some important hormones which control blood pressure, such as renin, angiotensin, and aldosterone hormones. In each of our kidneys, we have approximately 800,000 to 1 million small filters. We call them nephrons. They are very important for our kidneys and for us. We know that hypertension develops more in people with less number of nephrons. Nephrons are very clever parts of our kidneys. Besides, there are some sensors in our kidneys. What are they doing? When the blood pressure increased, the sensors take the message and regulates hypertension. But if the patient has kidney disease, the sensors cannot work. They cannot take the message, and this cannot be done. And I can say that there is a close relationship between kidneys and hypertension, especially with kidney disease and hypertension. For example, hypertension causes kidney disease, and kidney disease causes high blood pressure. So it should be remembered that the kidneys are the main players in hypertension, in hypertension patients. And these patients should be evaluated in terms of renal dysfunction. So at that time, we can detect possible kidney damage at an early stage, and we can treat our patients successfully.
Please tell me, Dr. Ulu, is it true that hypertension occurs through the kidneys, especially after COVID infection? And what should we do?
Yeah, we see this condition usually after the COVID infection. In 3 or 6 months, patients have increased blood pressure. This is a complication of COVID disease, COVID infection. At that time, we give some treatment to the patient, and then we turn the blood pressure at the normal levels. After 3 or 6 months, according to the patient's age or condition or chronic diseases, the blood pressure turns to normal, and then we are keeping the patient with normal blood pressure. And I want to say that if you had COVID infection, coronavirus infection, please check your blood pressure because it may be increased. This is important.
What should a patient with a kidney failure pay attention to, Dr. Ulu?
For kidney failure patients or kidney disease patients, it's very important to keep up regular follow-ups. For example, maybe every month or every 3 months, or maybe twice a month, according to the patient's disease stage. And also, it's very important to avoid unnecessary antibiotics, as I said before, harmful subjects, painkillers, such as in order to progress the disease. Our aim is to keep the stage because the kidney disease, kidney failure, progresses slowly day by day. If renal failure has reached to the end stage, such as GFR is smaller than 10 milliliters, what is GFR? It's glomerular filtration rate. I mean, what does it mean? How much do our kidneys work? It shows us. If it is smaller than 10 milliliters, this is end-stage renal disease. So we have to begin renal replacement therapies. What are they? For example, hemodialysis, peritoneal dialysis, and kidney transplantation. which is the best. Of course, kidney transplantation is the best. If we don't begin renal replacement therapies, in kidney failure, toxic metabolites substances cannot be eliminated from the kidneys, and they will accumulate in the body and may become harmful to all organ systems, especially to the brain and heart. So we have to begin at the time renal replacement therapies. As I said, the most distinguished and beneficial and comfortable therapy is kidney transplantation. Today, it can be performed successfully from a cadaver or a relative of the patient. And after kidney transplantation, the patient can live a more comfortable and healthy life without need for dialysis or without complications of kidney failure.
Please tell me, doctor, when we talk about kidney transplantation, is it a situation of life and death? What if the patient doesn't find a donor?
I couldn't get the question.
How hard is for a patient to find a donor when we talk about kidney transplantation, doctor?
Okay, if the patient will wait cadaver, it can take months or years. We cannot know, because if a patient, when a patient dies and gives her or his organs whom they need, we can find cadaver. But if cannot find cadaver, or if it's not suitable for the patient, so we are asking the patient that does he have any relevance to give kidney.
Doctor, please tell me, can a patient survive with only one kidney, and for how long?
Yeah, of course. The patient can survive many years with one kidney. It will be enough for him.
Okay, and my last question, Dr. Ulu, what's your recommendation for the persons who know that they have kidney problems?
Okay.
What should they do?
I can recommend them lifestyle change, healthy lifestyle, educate water intake, for example, 2 or 3 liters a day.
2 or 3 liters per day.
Yeah, regular exercise, and avoid any drug use, unnecessary drug use, especially painkillers, antibiotics, or drug abuse, and diet, especially healthy foods. It will be enough. If the patient has the kidney disease risk, for example, if he has diabetes or hypertension or any other familial disorders, they have to be careful, more careful about it, and they have to follow up their routine checkups.
Routine checkups, when should we do these routine checkups?
Normally, if the patient has not any risk, one time a year it will be enough. But if the patient, if the patient has diabetes or hypertension, every 3 months it will be enough.
Okay, thank you very much, doctor, for all these precious informations you offer to our Romanian viewers. Have a nice day.
Thank you. Have a nice day.
A fost, doamnelor, domnilor, așadar, profesorul Sena Ulu, medic specialist în nefrologie. Am vorbit despre ceea ce înseamnă problemele renale. Eu vă aștept săptămâna viitoare cu un alt medic de top din Turcia. Până atunci, toate cele bune, la revedere!